We're going to talk about the connections between health and well-being, the natural environment, academic research and innovation in practice. So we've got a great range of speakers who I think are going to weave the web of how all these strands interconnect so that we can all make a great contribution to the health of our citizens in this region and across the country.
Whether they're conscious decisions or not, the way people live is actually directly adding to both their personal ill health and also to the nation's need to spend increasing amounts of money on doing something about it. The Natural Health Service is actually specifically addressed at doing that.
We are building a great social prescribing movement in this country, and as I look out in this room, you are all part of it. In fact, you are all leading it.
We can think about, in this case, mental health as an ecosystem service, just like clean air, just like clean water, just like food production. Then we can think about, well, okay, how do we model, how do we estimate the impacts on mental health as an ecosystem service of environmental change? So we can model all those other things like sediment transport and so on, but perhaps we can also think about, well, if you do this to the environment, this is what it might result in terms of support for positive mental health.
And so over the last 12, 15 years or so, we've been developing projects and programs that do try to work with some of the people who are furthest away from being most physically active, to try and encourage those people who wouldn't normally go out into green spaces to do so. And we've been quite successful. We've run a number of projects that have shown really good results.
This is a new, innovative and bold approach, and innovation requires risk-taking. And we need to be transparent as a borough about what we're doing, and our learning, monitoring and evaluation will always be open and honest, even if that is sometimes painful. And we want this to be a long-term sustainable solution. We're not just about getting people engaged for a few weeks and then moving on to the next person. We have to start changing behaviours.
As I say, we're a group who are one of the first universities to be involved in the Centre of Excellence, and that's because we subscribe to the same principles, values, models and governance that fits with the Natural Health Service Consortium and its members. The match-funded PhD has been a real game changer for us in terms of how we can work on a day-to-day basis with the consortium. And we started to develop a critical mass of research activity across disciplines and expertise. So those colleagues in the room from other departments who have benefited from essentially what was our initial contact as a group in one aspect of the university. We welcome colleagues from psychology, from education, health and community, outdoor education, geography, and so on and so forth. So we've sort of provided an opportunity for other groups to get involved as well.
It's brought physical activity out of the elite sort of microcosm of the training of the stars and the Olympic gold medals, to understand that you can take Jo Brand, give her a training program and get her to walk for 7 days. Or many of the other people, engage them and get them to do things that are going to enhance their life and their own personal space and understanding of themselves.
Is it easy? Definitely not easy. And part of what today is about really is to focus on this, that it is a complex biopsychosocial problem, and it is going to require a whole host of agencies. It requires all party cross-government. It requires multi-agency both at national and local level. It will include the third sector in terms of charity. It has to be multicultural. It has to be sustainable, and we have to focus on that concept of population to the individual. But within that, the great outdoors offers that opportunity. Impossible is possible as long as we take a conjoined approach.